Health assessment. Introduction. Health assessment is an essential nursing function which provides foundation for quality nursing care and intervention. It helps to identify the strengths of the clients in promoting health. Health assessment also helps to identify clients' needs, clinical problems, or nursing diagnosis and to evaluate responses of the person to health problems and intervention and accurate and through health assessment reflect reflect the knowledge and skills of a professional nurse. Assessment is a key component of nursing practice required for planning and provision of assesses, plans, implement and evaluates nursing care in collaboration with individuals and the multidisciplinary healthcare team so as to achieve goals and health outcomes. Then moves to the definition. Definition. First, health assessment is a systematic, deliberative, and interactive process by which nurses use critical thinking to collect, validate, analyze, and synthesize the collected information in order to make judgment about the health status and life processes of individuals, families, and communities. Then second definition. Right now, objective data in nursing is part of the health assessment that involves the collection of information through observation in the healthcare environment. The senses of seeing, hearing, smelling, and touching are used to gather information about the patient behavior, action, test result, measurements, and the physical examination are also included. And the purpose and factor affecting health assessment. To understand the physical and mental well-being of the patient. म्हणजेच पेशंटची फिजिकल मेंटल ॲबिलिटी अंडरस्टँड करून घेणे. टू डिटेक्ट डिसीज इन इट्स अर्ली स्टेज. म्हणजे डिसीज कोणत्या स्टेजवर आहे. To determine the cause and the extent of disease. To understand any changes in the condition of disease and any improvement of or regression. To determine the nature of the treatment or nursing care needed for the patient. To safeguard the patient and his family by noting the early signs, especially in case of communicable disease. To contribute to the medical research, to find out whether the person is medically fit or not for a particular task. Then show the box 1.1 मध्ये शो केलं. Factor affecting health assessment. Physical setting, client personality and behavior, communication skill, problem, nurse's personality and behavior, nurse's knowledge and skill. Then principle of health assessment. In planning and performing health assessment, the nurse needs to consider the following. An accurate and timely health assessment provides foundation for nursing care, and intervention. A comprehensive assessment incorporates incorporates information about clients' physiologic, psychosocial, spiritual, health, cultural, and environmental factors as well as clients' developmental status. Second, the health assessment process should include data collection, documentation, and evaluation of the client's health status and responses to the health problems and interventions. All documentation should be objective, accurate, clear, concise, specific, and current. Health assessment is practiced in all healthcare settings whenever there is nurse-client interaction. Information gathered from health assessment should be communicated to other healthcare professionals in order to facilitate collaborative management of client and for continuity of care. Clients' confidentiality should be kept. Responsibility of nurse on health assessment. The nurse has the responsibility to carry out health assessment on every person under his or her care. The nurse should regularly perform focused assessment in response to client need. The nurse needs to obtain client's consent prior to health assessment. The nurse should demonstrate a caring attitude, respect, and concern for each client when doing a health assessment. The nurse has the responsibility in keeping confidentiality about the data being collected from his or her client. The nurse obtains information on a client using various techniques and tools such as history taking, physical examination, reviewing clients' records and results of diagnostic test. He or she has to draw inferences from data collected in order to make appropriate and sound clinical judgment. The nurse has to acquire specialized skill and competence in collecting accurate and relevant information on the patient's health in performing health assessment in order to make sound clinical decision. The nurse should document the result of health assessment, analyze the data collected, evaluate the clients. Response to health problems and interventions and provide feedback to the clients as appropriate. The nurse should continuously advance their competence in health assessment throughout one's nursing career. The nurse who take up an advanced practice role has the responsibility to prepare himself or herself in order to perform advanced and focused health assessment. Box 1.1. Discuss health assessment overview. Figure 1.1 shows nursing process and table 1.1 summarize overview and example of subjective and objective data. That's next part in this इंटरव्यू टेक्निक नेक्स्ट पार्ट में देखेंगे और ऑब्जर्वेशन टेक्निक भी हम नेक्स्ट पार्ट में देखेंगे। अभी के लिए इतना ही। थैंक यू।